ನಮಸ್ಕಾರ. ಆರೋಗ್ಯ ಮಾತುಕತೆಗೆ ಸ್ವಾಗತ. ಇದು ಮಂಗಳೂರಿನ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮತ್ತು ಆಸ್ಪತ್ರೆ ಅರ್ಪಿಸುವಂಥ ಆರೋಗ್ಯ ಮಾತುಕತೆ. ಇವತ್ತಿನ ಮಾತುಕತೆಯಲ್ಲಿ ನಾವು ಕಿಡ್ನಿ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಅಥವಾ ಕಿಡ್ನಿಗೆ ಉಂಟಾಗುವಂಥ ಆರೋಗ್ಯ ಸಮಸ್ಯೆಯ ಬಗ್ಗೆ ಮಾತಾಡಲಿಕ್ಕಿದ್ದೇವೆ. ಇವತ್ತಿನ ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ನಮ್ಮ ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ಹೈಸಮ್ ಅಬ್ದುಲ್ಕಾದರ್ ಅವರು ಭಾಗಿಯಾಗ್ತಾ ಇದ್ದಾರೆ. ನಾನು ಡಾಕ್ಟರ್ ಹೈಸಮ್ ಅಬ್ದುಲ್ಕಾದರ್ ಅವರನ್ನು ಸಮಸ್ತ ವೀಕ್ಷಕರ ಪರವಾಗಿ ಈ ಒಂದು ಮಾತುಕತೆಗೆ ಅತ್ಯಂತ ಪ್ರೀತಿಪೂರ್ವಕವಾಗಿ ಸ್ವಾಗತ ಮಾಡ್ತಿದ್ದೇನೆ. ಡಾಕ್ಟರ್, ವೆಲ್ಕಮ್ ಟು ದ ಶೋ. ನಾವು ಇವತ್ತಿನ ಮಾತುಕತೆಯಲ್ಲಿ ಕಿಡ್ನಿಯ ಏನದು ಯಾವ ರೀತಿ ಫಂಕ್ಷನ್ ಆಗುತ್ತೆ, ಯಾವ ಸಂದರ್ಭದಲ್ಲಿ ಸಮಸ್ಯೆಗಳು ಕಾಡುತ್ತೆ, ಈ ಸಮಸ್ಯೆಗಳು ಕಾಡಿದಾಗ ಯಾವ ರೀತಿಯ ಚಿಕಿತ್ಸೆ ಮತ್ತು ಏನು ಚಿಕಿತ್ಸೆ, ಈ ಎಲ್ಲ ವಿಚಾರಗಳನ್ನು ಮಾತಾಡಲಿಕ್ಕಿದ್ದೇವೆ. ಡಾಕ್ಟರ್ ಹೈಸಮ್ ಅಬ್ದುಲ್ಕಾದರ್ ಅವರು ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮತ್ತು ಆಸ್ಪತ್ರೆಯ ಕಿಡ್ನಿ ರೋಗ ಚಿಕಿತ್ಸಾ ವಿಭಾಗ ಅಂತ ನಾವು ಹೇಳ್ತೇವೆ, ಅಥವಾ ನೆಪ್ರಾಲಜಿ ವಿಭಾಗ ಅಂತ ಹೇಳ್ತೇವೆ. ಇದರಲ್ಲಿ ಅಸಿಸ್ಟೆಂಟ್ ಪ್ರೊಫೆಸರ್ ಆಗಿ ಕಾರ್ಯನಿರ್ವಹಿಸ್ತಾ ಇದ್ದಾರೆ. ತಜ್ಞ ಅನುಭವಿ ವೈದ್ಯರು. ನಾನು ಮಾತುಕತೆ ಸಂದರ್ಭದಲ್ಲಿ ಡಾಕ್ಟರ್ ಒಂದಷ್ಟು ವಿಚಾರಗಳನ್ನು ಇಂಗ್ಲೀಷ್ನಲ್ಲೇ ನಮ್ಮ ಮುಂದೆ ಪ್ರಸ್ತುತಪಡಿಸಲಿಕ್ಕಿದ್ದಾರೆ. ಮಧ್ಯೆ ಮಧ್ಯೆ ಕನ್ನಡದಲ್ಲಿ ಕೂಡ ಒಂದಷ್ಟು ವಿಚಾರಗಳನ್ನು ನಾನು ಅವರ ಪರವಾಗಿ ನಿಮ್ಮ ಮುಂದೆ ಇಡಲಿಕ್ಕಿದ್ದೇನೆ. ಎಸ್ ಡಾಕ್ಟರ್, ನಾರ್ಮಲ್ ಇನ್ ಜನರಲ್, what is the function of kidney or how it functions? Yeah.
Kidneys, they are a pair of delicate organs which receive 1/5 of the cardiac output. That means 20 to even 25% of the cardiac output, which is located in the body. And there are 2 kidneys present in all the people. So the main functions of kidney, as we all know, it is to remove the waste, removal of the excess waste from the body, as well as removal of the extra water, excess of fluid in the body. That is the most important function. And apart from that, the other functions are maintenance of a proper acid-base balance. This acid is secreted by the cells and tissues in the body, which has to be excreted, and maintenance of a proper balance, acid and base. That is also one function of the kidney.
ಇಲ್ಲಿ ವೈದ್ಯರು ಹೇಳೋ ಪ್ರಕಾರ ಇಡೀ ದೇಹದ ನೀರಿನ ಅಂಶವನ್ನು ಅಥವಾ ಕಲ್ಮಶ ತ್ಯಾಜ್ಯವನ್ನು ನಿರ್ವಹಣೆ ಮಾಡುವಂಥದ್ದು ಮತ್ತು ಆ್ಯಸಿಡ್ ಇದನ್ನು ನಿರ್ವಹಣೆ ಮಾಡುವಂಥ ಭಾರಿ ಮಹತ್ವದ ಮತ್ತು ಭಾರಿ ಪ್ರಮುಖವಾದ ಕಾರ್ಯವನ್ನು ಕಿಡ್ನಿ ಅಥವಾ ಕಿಡ್ನಿಯ ಮೂಲಕ ಅದು ನಡೆಯುತ್ತೆ ಅಂತದ್ದು.
Yes. Apart from that, it also plays an important role in the production of a hormone called erythropoietin. It is this hormone which prevents anemia, and if in the later stages of kidney disease we see that hemoglobin is low, that is because of the decreased production of this hormone called erythropoietin. It also plays an important role in maintenance of the proper calcium, phosphorus, a hormone called PTH, this balance. And an active form of vitamin D is also produced by the kidney.
ಅನೇಕ ವಿಚಾರಗಳದು ನಮಗೆ ಮೇಲ್ನೋಟಕ್ಕೆ ಗೊತ್ತಿರೋದಿಲ್ಲ. ನಾವು ಇಷ್ಟೇ ಅಂತ ತಿಳ್ಕೊಂಡಿರ್ತೇವೆ, ನೀರು ಅಥವಾ ಮೂತ್ರ ಇದರ ಬಗ್ಗೆ ಅಷ್ಟೇ ಮಾತಾಡ್ಕೊಂಡಿರ್ತೇವೆ ನಾವು, ಕಲ್ಮಶ ಅಥವಾ ಅದನ್ನು ತ್ಯಾಜ್ಯ ಅಂತ, ಅದರ ನಿರ್ವಹಣೆ ಅಂತ. ಬಟ್ ಡಾಕ್ಟರ್ ಹೇಳಿದಾಗೆ ಅದು ದೇಹದಲ್ಲಿ ಉತ್ಪತ್ತಿಯಾಗುವಂಥ ಹಾರ್ಮೋನ್ ಮತ್ತು ಈವನ್ ವಿಟಮಿನ್ ಡಿ ಇದರ ಉತ್ಪತ್ತಿಗೆಲ್ಲ ಮುಖ್ಯವಾದಂಥ ಕಾರಣವಾಗುವಂಥದ್ದು ಕಿಡ್ನಿ. ಎಸ್ ಡಾಕ್ಟರ್, if come to the issue disease, how you classifies the disease in related to kidneys?
Yes, broadly kidney diseases can be classified into AKI and CKD. AKI means it's acute kidney injury, and CKD is chronic kidney disease. So acute kidney injury, according to the terminology itself, it's an acute. Acute means it is sudden in presentation. And hence we know that it is reversible if it is treated early. So it's important to know what has caused the acute kidney injury, or what is the causative agent to cause that acute worsening of creatinine. So it can be anything. And the second thing is called chronic kidney disease. Chronic kidney disease means kidney disease is lasting for 3 months or more. It can, according to the definition, it is the structural or functional damage which is occurring to the kidney. And the GFR is the word which is used to know the kidney function. GFR is less than 60 ml per minute per body surface area. This is 1.73 meter square, which is lasting for 3 months or more. So when the GFR is less than 60, which is lasting for 3 or more months, and there is a structural or functional damage which is occurring to the kidney. That is called chronic kidney disease. In between this, there is acute on CKD. That means already the patient has got CKD, and some factor has caused an acute worsening or sudden worsening. That is called acute on CKD.
ವೈದ್ಯರುಗಳ ಪ್ರಕಾರ ಈ ರೀತಿಯಾಗಿ ಎರಡೂ ರೀತಿಯ ಸಮಸ್ಯೆಗಳು ಕಾಣಿಸಿಕೊಳ್ಳುವಂಥದ್ದು ತಕ್ಷಣ ಒಂದು ಸಡನ್ನಾಗಿ ಬರುವಂಥ ಸಮಸ್ಯೆ, ಅಥವಾ ಇನ್ನೊಂದು ಅವರು ಹೇಳೋ ಪ್ರಕಾರ ಏನು CKD ಸ್ವಲ್ಪ 3-3.5 ತಿಂಗಳು ಅಥವಾ ಆಸುಪಾಸಿನ ತನಕ ನಿಮಗೆ ಅದು ಸಮಸ್ಯೆಯಾಗಿ ಕಾಡಿ ಮತ್ತು ಅದು ಗಂಭೀರವಾಗಿ ಸಮಸ್ಯೆಯಾಗಿ ಕಾಡುವಂಥದ್ದು. ಈಗ ಡಾಕ್ಟ್ರೇ, ಅದು ಯಾವ ಕಾರಣಕ್ಕೆ ಕಿಡ್ನಿಗೆ ಸಮಸ್ಯೆಗಳು ಬರುತ್ತೆ ಅಂತ, ವಾಟ್ ಇಸ್ ದ ಕಾಸಸ್?
Yeah, it is important to know what has caused the kidney disease, because it is based on the causative factor we can treat, and the treatment of kidney disease definitely it is to treat the cause. What has caused the kidney disease, that has to be treated. So the most common cause, it is all over the world, it is diabetes mellitus. Diabetes mellitus, more than 50% of the cause of kidney disease is due to diabetes. Then
it means there is another question also arises. If all diabetes patients will they
develop kidney disease? Yeah, diabetes mellitus, all patients will not develop. It is actually the duration of diabetes is important. Like 20-year history of diabetes has got higher risk compared with a history of diabetes of only 5 years. And how much the blood sugar is controlled. Like if the blood sugar is always uncontrolled, like it is in 400, 500, even if it's for a shorter duration, the damage to the kidney is so huge that it can cause a faster worsening of renal functions and lead to a CKD. The second cause after diabetes comes hypertension.
ಒನ್ ಸೆಕೆಂಡ್ ಡಾಕ್ಟರ್. ಇಲ್ಲಿ ವೈದ್ಯರು ಹೇಳೋ ಪ್ರಕಾರ ಕಿಡ್ನಿಯ ಈ ರೀತಿಯ ಸಮಸ್ಯೆಗಳಿಗೆ ಅಥವಾ ಆರೋಗ್ಯ ಸಮಸ್ಯೆಗಳಿಗೆ ಬಹುಮುಖ್ಯವಾದ ಕಾರಣ ಏನು ನಾವು ಮಧುಮೇಹ ಅಂತ ಹೇಳ್ತೇವೆ, ಡಯಾಬಿಟಿಕ್, ಇದು ಭಾರಿ ಪ್ರಮುಖವಾಗಿ ಕಾರಣ ಆಗುತ್ತೆ ಅಂತ. ದ ಸೆಕೆಂಡ್ ರೀಸನ್.
Second reason is systemic hypertension. Systemic hypertension means the blood pressure is high.
ಅಧಿಕ ರಕ್ತದ ಒತ್ತಡ, BP ಅಂತ ಹೇಳ್ತೇವೆ ಜನರಲ್ ಭಾಷೆಯಲ್ಲಿ ನಾವು.
BP is high. Then the other causes are like intake of painkillers. Some people has got a habit of going to pharmacy taking painkillers. If it is taken for a longer duration of time and more number of tablets, that can cause irreversible damage to the kidney.
ವೈದ್ಯರು ಹೇಳುವಂಥ ಇನ್ನೊಂದು ಬಾರಿ ಏನು ಗಂಭೀರವಾಗಿ ತಿಳ್ಕೊಳ್ಬೇಕಾದ ವಿಚಾರ, ಪೇಯ್ನ್ ಕಿಲ್ಲರ್. ನೀವು ಅನೇಕ ಬಾರಿ ಬೇರೆ ಬೇರೆ ಏನು ಸಣ್ಣ ಪುಟ್ಟ ನೋವುಗಳಿಗೆ ಕೊಡೋಗಿ ಪೇಯ್ನ್ ಕಿಲ್ಲರ್ ತಗೊಳ್ತೀರಲ್ಲ, ಇದು ಕಿಡ್ನಿಗೆ ದೊಡ್ಡ ಸಮಸ್ಯೆಯಾಗಿ ಕಾಡುತ್ತೆ ಅಂತ. ಹೌ ದಿಸ್ ಎಫೆಕ್ಟ್ if anybody takes a painkiller?
It can if you ask me, the pathogens, actually there is changes which is occurring in the kidney vessels. Inside the kidney there is nephrons. There is 1 million nephrons present in each kidney. So inside the 1 million nephron is present in each kidney, and in each nephron has got multiple parts. One most important part is called glomeruli. The other parts is renal tubules. So changes will occur to the glomeruli, and glomeruli is nothing but the very very small vessels which are located in the kidney. So it will cause constriction or narrowing of the vessels which is applying to the nephron, and that will increase if it is taken for a longer duration of time, it can cause irreversible damage.
One is diabetic, then the hypertension, and this painkillers.
Then
any more?
Definitely there are other causes such as obstruction. Any obstruction, it can be in the form of stones. That is the most common form of obstruction, stones. If it is obstructing one kidney, that can cause damage to that particular kidney. If both kidneys has got stone, or there is stone.
Why this stone develops? Or how it develops?
Actually some people has got a higher risk of development of stones, and we'll have
ಯಾಕೆ ಅಥವಾ ಮೂತ್ರಕೋಶದಲ್ಲಿ ಯಾಕೆ ಕಲ್ಲು ಉತ್ಪತ್ತಿ ಆಗುತ್ತೆ ಅಂತ.
There are so many types of stones also. The risk factors is more amount of calcium going in the urine. We call it hypercalciuria. That is one risk factor. Second is hyperoxaluria. That means more oxalates in the urine. third is hypocitrate urine, decreased citrate in the urine. So you ask me why some people develop stones. The risk factor, diet is a risk factor. Then the second is genetic factors are the risk factor. Dehydration can be risk factor. But definitely genetic factor is factor, because they keep on forming stones. Once the stone is removed, some people, they have got a tendency to form stones again.
Is there if somebody consuming very less
less salt is important. That is also one of the dietary management to prevent formation of kidney stones. Yes.
ಡಾಕ್ಟರ್ ಏನ್ಯಾವ ಈಗ ನೀವು ವೈದ್ಯರು ಯಾವ ಕಾರಣಕ್ಕೆ ಕಿಡ್ನಿಯಲ್ಲಿ ಕಲ್ಲು ಬರುತ್ತೆ ಅನ್ನೋಂಥ ವಿಚಾರನ ಹೇಳಿದರು. ದ ಥಿಂಗ್ ಇಸ್ ಹೌ ಟು ಇನ್ವೆಸ್ಟಿಗೇಟ್. ಈಗ ನಾನು ವೈದ್ಯರ ಹತ್ರ ಕೇಳಲಿಕ್ಕೆ ಬಯಸುವಂಥದ್ದು, ಒಬ್ಬ ವ್ಯಕ್ತಿಗೆ ಕಿಡ್ನಿಗೆ ಏನಾದರೂ ಸಮಸ್ಯೆಗಳು ಕಂಡು ಬಂದಾಗ ಆಸ್ಪತ್ರೆಗೆ ಹೋದಾಗ ಅವರು ಯಾವ ರೀತಿ ತಪಾಸಣೆ ಮಾಡ್ತಾರೆ ಅಂತ. ವಾಟ್ ಇಸ್ ದ ಇನ್ವೆಸ್ಟಿಗೇಷನ್?
Kidney investigations, they are basic investigations which we routinely do, of which the most important is serum creatinine. Serum creatinine is a simple test, it's a cheap test, it's available everywhere, and we get the report probably within 1 hour. So that is one very good thing about nephrology, that we'll be able to know the function of kidney to probably to 90% extent we can know by doing a simple test called serum creatinine, which is easily available, and we get the report fast.
ಕ್ರಿಯಾಟಿನ್ ಅನ್ನುವಂಥ ತಪಾಸಣೆ ಮೂಲಕ ಕೇವಲ 1 ಗಂಟೆ ಅವಧಿಯಲ್ಲಿ ನಿಮ್ಮ ಕಿಡ್ನಿ ಆರೋಗ್ಯದ ಬಗ್ಗೆ 90% ನಿಖರವಾದಂಥ ಮಾಹಿತಿಗಳು ಲಭ್ಯ ಆಗುತ್ತೆ ಅಂತ ವೈದ್ಯರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ.
And it is from this serum creatinine we get a thing called GFR. GFR is glomerular filtration rate. So from the GFR we will be able to know what stage of kidney disease the patient is in at present. So GFR, so I'll talk more about GFR. A normal GFR of a person who is having a normal kidney, normal functioning kidney, is 120 ml per minute. So once the kidney disease progresses to a higher stage, the GFR comes down. So we can divide that CKD based on GFR into 5 stages: stage 1, stage 2, stage 3, stage 4 and stage 5. Stage 1 is the GFR is more than 90, but there is some structural damage or functional damage already there in the kidney. Stage 2, the GFR is between 60 to 90. Stage 3, the GFR is between 30 to 59, which itself can be divided further into stage 3A, stage 3B. 3A means the GFR is between 46 to 59, and 3B, the GFR is between 30 to 45, and stage 4, the GFR is between 16 to 29, and it is the final stage called CKD stage 5, where the GFR is 15 or below 15. And
ವೈದ್ಯರು ವೈದ್ಯಕೀಯ ಟರ್ಮಿನಾಲಜಿಯಲ್ಲಿ ಹೇಳಿದ್ರು ಅದನ್ನು, ಅಂದರೆ ಈ ಗಂಭೀರತೆಯನ್ನು, ಅದರ ಸಿವಿಯರ್ನೆಸ್ ಅಂತ ನಾವೇನು ಹೇಳ್ತೇವೆ, ಈ ರೀತಿಯ 5 ಹಂತಗಳಲ್ಲಿ ಕಿಡ್ನಿಯ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಅಥವಾ ಅದರ ಗುಣಮಟ್ಟದ ಬಗ್ಗೆ ಅಥವಾ ಉಂಟಾಗಿರೋ ಸಮಸ್ಯೆಯ ಬಗ್ಗೆ ಅದನ್ನು ಕ್ಲಾಸಿಫಿಕೇಶನ್ ಮಾಡಲಿಕ್ಕೆ ಆಗುತ್ತೆ ಅಂತ.
And the symptoms in most of the cases will be manifested only in the final stage or the stage 5. In many of the cases. That means the GFR is already less than 15. Hence it is very important to screen whether there is any kidney disease.
It means you are saying until that time normally you won't get any symptoms.
Yes, there may not be any symptoms.
Why of the cases. Why?
Yeah, because even a GFR of 20 or 25, the patient will be having good urine output. Urine will be good. There may not be any swelling in the legs. He may feel that he is fine, but once it goes below 15, there can be symptoms like we call it uremic symptoms, decrease in appetite, decreased food intake, a feeling of sensation of vomiting, nausea.
ವೈದ್ಯರು ಹೇಳುವಂಥದ್ದು ಇವನ್ ಅತ್ಯಂತ ಗಂಭೀರ ಹಂತಕ್ಕೆ ಬರುವ ಸಂದರ್ಭದಲ್ಲೂ ಕೂಡ ಎಷ್ಟೋ ಬಾರಿ ಯಾವುದೇ ಗುಣಲಕ್ಷಣಗಳೇ ಗೋಚರಿಸುವುದಿಲ್ಲ. ಸಾಮಾನ್ಯವಾಗಿ ಜನರು ತಿಳ್ಕೊಂಡಿರ್ತಾರೆ ನಮಗೆ ಸರಿಯಾದ ಏನು ಮೂತ್ರಶಂಕೆ ಮಾಡಲಿಕ್ಕೆ ಆಗುತ್ತೆ, ಹಾಗಾಗಿ ನಥಿಂಗ್, ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಅಂತ. ಸೊ ಬಟ್ ಅಂಥ ಸಂದರ್ಭದಲ್ಲಿ ಕೂಡ ಅದು ಗಂಭೀರ ಹಂತಕ್ಕೆ ಬಂದಿರುತ್ತೆ ಅಂತ.
Yeah, yes. So the first investigation which I told is serum creatine, and with that we can calculate the GFR. The other investigation is another simple test which is a non-invasive test is sending urine sample. Urine we can look whether there is any excessive protein which is going in the urine. Urine analysis has to be sent to look for excess protein. Urine ACR is a better test. ACR is albumin creatine ratio. Normal value is less than 30 milligram per gram. In a normal person, the urine ACR is less than 30 milligram per gram. If it is higher, that means there is more protein being excreted in the urine. How much high it is, that much severe is the protein which is going in the urine.
Yes. Now I come to the point out the treatment. In between that, do you advise any common people a regular kidney checkup is needed?
Yeah. A patient
Because
who
you
is
told that in some cases till the 4th stage, 5th stage also, there is no symptoms.
Yes. A patient who is already having kidney disease, CKD, that means they will have to do...
I'm asking a normal person.
Yeah, exactly. Normal person will have to do RFT and urine analysis at least once in a while, maybe once in 3 to 5 years, at least.
ನಿಮ್ಮ ಆರೋಗ್ಯ ಎಲ್ಲ ರೀತಿಯೂ ಸ್ಥಿರವಾಗಿದೆ ಅಂತ ಇದ್ರೂ ಕೂಡ ನೀವು 4-5 ವರ್ಷಕ್ಕೊಮ್ಮೆ ಆದರೂ ಕಿಡ್ನಿಯ ಒಂದು ತಪಾಸಣೆ ಮಾಡಿಕೊಳ್ಳಬೇಕು ಅನ್ನುವ ವಿಚಾರವನ್ನು ವೈದ್ಯರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ವಿಲ್ ಕಮ್ ಟು ದ ಟ್ರೀಟ್ಮೆಂಟ್.
Fine, yes. The treatment is definitely the treatment of kidney disease is to treat the cause. Like if dehydration had caused the rise in creatine, like maybe probably working in under the hot sun and
ತುಂಬಾ ಬಿಸಿಲಿಗೆ ಮೈಯೊಡ್ಡಿ ಕೆಲಸ ಮಾಡುವಂತದ್ದು.
Yes, and patient becomes dehydrated. But still there is a natural mechanism of the kidney to concentrate the urine. When the body becomes so dehydrated, we see that the urine is yellowish in color, orangish in color. That is because the urine is so concentrated. That is the normal mechanism. But there can be a small rise in creatine. So if there is dehydration, the treatment is to treat the dehydration. You will have to hydrate yourself. You can drink water. If drinking water is not possible, giving IV fluids, normal saline. That is one. Then if stone is the cause of kidney disease, remove that obstruction.
Normally there's a saying, those who drinks less water, they will get this kidney problem.
Need not, because the commonest cause of kidney disease is not dehydration.
Okay.
Chronic kidney disease, it is diabetes.
Diabetes
I should bring awareness of diabetes more. But it is also very important to be properly, adequately hydrated. That means proper water intake is needed. And in the final stage of CKD, that means if the GFR is less than 15, the urine output will be low in most of the cases. In such case, drinking too much water will cause problems.
Yes.
And patients who are already on dialysis, who drink more water, they will start developing swelling in the legs, edema.
ಡಯಾಲಿಸಿಸ್ ಅಲ್ಲಿ ನಡೀತಾ ಇರೋ ಸಂದರ್ಭದಲ್ಲಿ ವೈದ್ಯರು ಹೇಳಿರ್ತಾರೆ ಎಷ್ಟು ಪ್ರಮಾಣದ ನೀರು ಕುಡಿಬೇಕು ಮತ್ತು ಕುಡಿಬಾರದು ಅಂತ.
And the other causes,
you are talking about the treatment.
The treatment, like if diabetes is the cause of kidney disease, very good control of blood sugar. Proper blood sugar means we can check a FBS, fasting blood sugar, postprandial blood sugar, a random blood sugar, and a 3-monthly test called HbA1c. This is easily available everywhere. And so this is also important that it is within the target range. Within the target range should be controlled. And once in a while, once in 6 months to once in a year, eye checkup is important because of complications.
Why eye checkup is important?
Because long-standing diabetes can cause damage to the retina in the form of retinopathy.
Yes.
And
ಸಾಮಾನ್ಯ ಕಣ್ಣಿನ ಡಾಕ್ಟರ್ಗಳು ಕೂಡ ಅದನ್ನೇ ಹೇಳ್ತಾ ಇರ್ತಾರೆ.
Kidney causes proteinuria, excessive protein being excreted in the urine. It can cause other organ damage also, like heart, the vessels in the lower limb. It can cause blockage in the lower limb vessels. So definitely treatment is to treat the cause. If there is hypertension, salt restriction, proper control of blood pressure. Then if the other cause of kidney disease is glomerulonephritis, that means excessive protein is being lost in the urine. So regular checkup with a kidney specialist, with a nephrologist is important to have a check how much protein is being lost in the urine. And it is important because of the kidney disease also the blood pressure rises up. So proper control of BP is also important.
Yes.
Yes.
At what stage this dialysis required?
Dialysis is required only when in the final stage. It is called CKD stage 5, or we call ESRD, that is end stage renal disease. The patient at that time will have symptoms like there may be weight loss will be there. There may not be any interest in the food. There can be even itching, pruritus can be there. Pruritus means itching all over the body. So they will come to OP telling that I don't feel hungry at all. Then when we check the creatine, incidentally, probably for the first time the creatine might be 8 or 9. The normal creatine is between 0.7 to 1.3.
Okay.
Okay.
When you advise for the renal transplantation?
Yeah. There are two options of treatment. One is dialysis, second is renal transplantation. Dialysis is hemodialysis, which is done in the hospital. Patient comes to hospital 3 times a week. Each dialysis is for 4 hours. And the second option is peritoneal dialysis, which you told, which can be done at home, which is to be done at home with a proper caring responsible bystander. And the second option is
ಕೂಡ ಆಸ್ಪತ್ರೆ ಜೊತೆಗೆ ಈಗ ಡಾಕ್ಟರ್ ಹೇಳೋ ಪ್ರಕಾರ ಮನೆಯಲ್ಲಿ ಕೂಡ ಮಾಡಿಕೊಳ್ಳಿಕ್ಕೆ ಆಗುತ್ತೆ, ಸ್ವಲ್ಪ ಸೂಕ್ಷ್ಮತೆ ಬೇಕು ಅದಕ್ಕೆ.
And the second is renal transplantation. It is definitely, as my friend has already told, that renal transplantation is definitely a better option, a good option compared to dialysis for a particular section of people. Like we feel the transplant is a better option. Such patients should go for transplant because the quality of life is better than those patients who are on dialysis. Because during dialysis also problems can develop. Like during dialysis BP can come down, BP can increase. It is called intradialytic hypotension or intradialytic hypertension. Other problems during dialysis. And and they have to come to hospital 3 times a week, has to be on a big number of medicines. Compared to that, renal transplant is definitely a better option, especially for younger people.
Yes, Doctor, in Enupoya Hospital, particularly in your nephrology department, what speciality how it differ from other?
Our Enupoya Hospital is doing a large number of transplants. Actually, in the city, we are leading in the number of transplants. We are doing the maximum number of transplants in the city. And fortunately, all patients are doing well who has already underwent transplantation. They are having a good quality of life. They are having a good renal functions. Their urine output is good. We are still following them up. They are from northern parts of Karnataka, but still they come for follow-up. We see them in OPD, and it's very happy to know that they are actually their renal functions are still good.
ಖಂಡಿತ ಒಬ್ಬ ವೈದ್ಯರಿಗೆ ಒಂದು ಎಟ್ ದ ಎಂಡ್ ಆಫ್ ದ ಡೇ ಖುಷಿ ಅಂತ ಅನಿಸುವುದು ತಾನು ಕೊಟ್ಟ ಚಿಕಿತ್ಸೆಯ ಫಲಾನುಭವಿ ಅವರ ಮುಖದಲ್ಲಿರುವ ಮಂದಹಾಸ, ಆ ಖುಷಿಯನ್ನು ಕಂಡರೆ ವೈದ್ಯರಿಗೆ ಕೂಡ ಸಂತೃಪ್ತಿ. ಎಸ್ ಡಾಕ್ಟರ್, ಎಟ್ ದ ಎಂಡ್ ಒಂದು ವ್ಯಕ್ತಿಯ ಅಥವಾ ಒಂದು ಪರ್ಸನ್ ಆತನ ಕಿಡ್ನಿಯ ಆರೋಗ್ಯದ ಒಂದು ಸಸ್ಟೈನಬಲ್, ನಾವು ಸುಸ್ಥಿರ ಆರೋಗ್ಯವನ್ನು ಕಾಪಾಡಲಿಕ್ಕೆ ನೀವು ಏನು ಅಡ್ವೈಸ್ ಮಾಡ್ತೀರಿ ಅಂತ? ವಾಟ್ ವಿಲ್ ಅಡ್ವೈಸ್ ಫಾರ್ ದ ಪೀಪಲ್ ಟು ಮೇಂಟೈನ್ ದೇರ್ ಕಿಡ್ನಿ ಹೆಲ್ತ್? For example, the lifestyle.
Okay.
How to maintain, what to do and what not.
Yes. The best thing is to have a proper checkup with the doctor. Like he should be in the proper BMI. That means he should not be obese. He should not be overweight. He should not be overweight. His blood pressure has to be controlled. Less than 130/80. And proper diet. And avoid any medicines which can cause damage to the kidney for a prolonged period of time. And then the symptoms wise, if you notice a froth or like bubbles in the urine, that you have to be careful. It could be excretion of protein, lossage of protein in the urine, which can happen even without diabetes. there is a category of kidney disease called glomerulonephritis. Means there is excessive lossage of protein in the urine. This is also one important cause of chronic kidney disease. So if anybody is noticing froth in the urine, or if you flush in the toilet,
Yes.
still there froth is still persisting, that means you have to do a urine analysis.
Yes,
Just
ಚೆಕಪ್
to-
ಮಾಡಿಕೊಳ್ಳಬೇಕು.
Yes. These are actually the test is very simple, and ultrasound abdomen can be done just to rule out whether there is any stones, kidney stone, whether there is any obstruction in the form of stones or tumor or anything.
Yes.
Yeah.
ವೀಕ್ಷಕರೇ, ಅನೇಕ ವಿಚಾರಗಳನ್ನು ವೈದ್ಯರು ನಮ್ಮ ಮುಂದೆ ಹಂಚಿಕೊಂಡರು. ಕೊನೆಯದಾಗಿ ಒಂದು ವ್ಯಕ್ತಿಯ ಆರೋಗ್ಯವಂತ ವ್ಯಕ್ತಿಯ ಮತ್ತು ಆರೋಗ್ಯ ಸಮಸ್ಯೆ ಇರೋದಾದರೂ ಕೂಡ ಕಿಡ್ನಿಯ ಆರೋಗ್ಯವನ್ನು ಮೇಂಟೈನ್ ಮಾಡಲಿಕ್ಕೆ ನಾವು ಏನು ಮಾಡಬೇಕು ಅನ್ನುವಂಥ ಸಲಹೆಯನ್ನು ಕೂಡ ಕೊಟ್ಟರು. BP ಹೆಚ್ಚು ಕಡಿಮೆ ಆಗದಾಗೆ ನೋಡಿಕೊಳ್ಳುವಂಥದ್ದು, ಮಧುಮೇಹ, ಶುಗರ್ ಚೆಕ್ ಮಾಡ್ತಾ ಇರುವಂಥದ್ದು, ಮತ್ತು ಹೇಳಿದರು ಮೂತ್ರಶಂಕೆ ಮಾಡಿದ ನಂತರ ನೀವು ಏನು ವಾಶ್ರೂಮಲ್ಲಿ ಬಬಲ್ಸ್, ಕೊನೆಗೆ ಆ ನೀರಿನಲ್ಲಿ ಬಬಲ್ಸ್ ಇರುತ್ತಾ ಅಂತ ಗಮನಿಸಿ, ಅತಿಯಾದ ಬಬಲ್ಸ್ ಇದ್ದರೆ ಒಮ್ಮೆ ಚೆಕ್ ಮಾಡಿದ್ರೆ ಒಳ್ಳೆಯದು. ಬೆಟರ್ ಅಂತ.
Elder people like above 60 years, 65 years, there can be prostatomegaly, prostate gland which is seen in males only. It can increase in size. It can cause an obstruction. So the patients can present with decreased speed of passage of urine. Decreases stream of flow of urine. They wake up from the night at 2 to 3 times to pass urine. Even after they pass urine, they have a sensation that I have not passed full. There is some urine still remaining in the bladder. And there can be an urgency, like if I feel to pass urine, I have to rush to the toilet. And hesitancy means once they go to the toilet, the starting, there is a time, there is a lag. That is called. These are symptoms of prostatomegaly, which means the prostate gland is enlarged in size. So once the prostate enlarges, it can cause obstruction. So the speed of urine can come down, which can be treated actually. This is very common in males above 60-65 years.
ಎಷ್ಟೋ ಮಂದಿಗೆ ಏನು ಟಾಯ್ಲೆಟಿಗೆ ಮೂತ್ರಶಂಕೆ ಮಾಡಬೇಕಂತ ಹೋದರೂ ಕೂಡ ಅಲ್ಲಿ ಏನೋ ಅಡೆತಡೆ ಆದಂಥ ಅನಿಸುವಂಥದ್ದು, ಅಥವಾ ರಾತ್ರಿಯಲ್ಲಿ ಪದೇ ಮೂತ್ರಶಂಕೆ ಮಾಡಬೇಕಂತ ಅನಿಸುವಂಥದ್ದು, ಅಥವಾ ಮೂತ್ರ ಮಾಡಿದ ನಂತರ ಕೂಡ ನಾನು ಪೂರ್ತಿಯಾಗಿ ಮೂತ್ರ ಮಾಡಲಿಲ್ಲವೋ ಅಂತ ಅನಿಸುವಂಥ ಒಂದು ಚಡಪಡಿಕೆ, ಇವೆಲ್ಲವೂ ಕೂಡ ಎಲ್ಲೋ ಕಿಡ್ನಿ ಆರೋಗ್ಯದಲ್ಲಿ ಸ್ವಲ್ಪ ಏರುಪೇರಾಗಿದೆ ಅನ್ನೋದರ ಲಕ್ಷಣಗಳು. ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ಹೇಳಿದರು, ಏನು ಪ್ರೋಸ್ಟೇಟ್ ಅದು ಒಂದು 60 ವಯಸ್ಸಿನ ನಂತರ ದೊಡ್ಡದಾಗುವಂಥದ್ದು. ಸೊ ಅದು ಕೂಡ ಮತ್ತೆ ಏನು ಮೂತ್ರಶಂಕೆ ಮಾಡಲಿಕ್ಕೆ ನಿಮಗೆ ಸಮಸ್ಯೆ ಒಡ್ಡುತ್ತೆ. ಸೊ ಅದನ್ನೆಲ್ಲ ಚಿಕಿತ್ಸೆಯ ಮೂಲಕ ಪರಿಹಾರ ಮಾಡಿಕೊಳ್ಳಿಕ್ಕಾಗತ್ತೆ. ಬಟ್ ಟೈಮ್ಲಿ ನಾವು ವೈದ್ಯರನ್ನು ಭೇಟಿ ಮಾಡುವಂಥದ್ದು. ತುಂಬ ಒಳ್ಳೆಯ ವಿಚಾರಗಳನ್ನು ಕಿಡ್ನಿ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಇವತ್ತಿನ ಮಾತುಕತೆಯಲ್ಲಿ ಡಾಕ್ಟರ್ ಹೈಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರು ನಮ್ಮ ಜೊತೆಗೆ ಹಂಚಿಕೊಂಡಿದ್ದಾರೆ. ನಾನು ಸಮಸ್ತ ವೀಕ್ಷಕರ ಪರವಾಗಿ ಅವರಿಗೆ ಪ್ರೀತಿಪೂರ್ವಕ ಧನ್ಯವಾದವನ್ನು ಅರ್ಪಿಸಿದ್ದೇನೆ. ಡಾಕ್ಟ್ರೇ, ಥ್ಯಾಂಕ್ ಯು. ಆರೋಗ್ಯ ಮಾತುಕತೆಯನ್ನು ಇಲ್ಲಿ ಸಮಾಪನ ಮಾಡ್ತಾ ಇದ್ದೇನೆ. ಇದು ಯನಪೋಯ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮತ್ತು ಆಸ್ಪತ್ರೆ ಅರ್ಪಿಸುವಂಥ ಆರೋಗ್ಯ ಮಾತುಕತೆ. ಇವತ್ತಿನ ಈ ಮಾತುಕತೆಯಲ್ಲಿ ನಮ್ಮ ಕಿಡ್ನಿಯ ಆರೋಗ್ಯದ ಬಗ್ಗೆ ಮತ್ತು ಅದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟ ಚಿಕಿತ್ಸೆಯ ಬಗ್ಗೆ ಏನೆಲ್ಲ ನಾವು ಗಮನದಲ್ಲಿಟ್ಕೊಳ್ಬೇಕು, ಮತ್ತು ಯಾವ ಸಂದರ್ಭದಲ್ಲಿ ವೈದ್ಯರನ್ನು ಭೇಟಿ ಮಾಡಬೇಕು, ಮತ್ತು ಯಾಕೆ ಭೇಟಿ ಮಾಡಬೇಕು, ಮತ್ತು ಯಾವ ರೀತಿ ಚಿಕಿತ್ಸೆಗಳೆಲ್ಲ ಲಭ್ಯ ಇದೆ ಅನ್ನೋ ವಿಚಾರವನ್ನು ಡಾಕ್ಟರ್ ಹೈಸಮ್ ಅಬ್ದುಲ್ ಖಾದರ್ ಅವರು ನಮ್ಮ ಜೊತೆಗೆ ಹಂಚಿಕೊಂಡರು. ಅವರಿಗೆ ನಾನು ಮತ್ತೊಮ್ಮೆ ಧನ್ಯವಾದವನ್ನು ಅರ್ಪಿಸಿ ಈ ಒಂದು ಮಾತುಕತೆಯಲ್ಲಿ ಸಮಾಪನ ಮಾಡ್ತಿದ್ದೇನೆ. ಥ್ಯಾಂಕ್ ಯು.